All right. So blastomycosis. Again, the route of entry is inhalation, and this is via conidia. Okay, can I have your attention, please? Can I have your attention, please? So there is endemic mycosis present at different levels in different states. And of course, if I told you that it's a Chicago's disease as well, so we do have that. And if you look at the outbreaks that we may have in terms of blastomycosis, these records basically are not maintained by the textbooks. They are maintained by the health authorities, the regional or the state health authorities. So that's where we can find it out. But most of the time, we see blastomycosis either as a pulmonary disease, because that's where you inhale conidia, or if it is absorbed into the blood, we may have an extrapulmonary disseminated disease as well. And when it disseminates, as you can see, most of it, like two-thirds of and bones. So this will be a extra pulmonary involvement in blastomycosis. And I told you earlier, whether it's a bacterial infection or it is infection by fungi, is difficult to treat when it goes into the bones. But the other important hematogenous dissemination can include prostate, liver, spleen, kidney, and central nervous system. So as a rule, anything that goes through the blood can go anywhere. And when you do see patients having disseminated disease, as I said earlier, think fungus as well, because fungi has become now an important disease in terms of differential diagnosis that we have. Okay. Same old routine. You will see over here diagnosis results from microscopic detection. And then we can also look for diagnosis in a sputum, bronchoalveolar lavage, or lung biopsy, and stain to look for conidia. And many a times, as we know, that we would rather go for a quick diagnostic step, and that basically means that we make fresh wet preparations of all those places that we can obtain our sample from, and look for a characteristic yeast form to identify diagnosis of blastomycosis. And most of the time, you see a broad-based budding yeast, and I'm going to talk about that in a while when I'm going to show you the PDFs of the study guide posted, so you can see how do we differentiate. So that is considered as a definitive diagnosis if you do see a disease process like pulmonary, extrapulmonary, along with a budding yeast that is there in that sample that we look at. Again, treatment depends upon the condition of the patient. And once we diagnose that this is blastomycosis, we are going to look at the immune status. We're going to look at antifungal options that we have. Again, keep in mind that antifungal options, especially IV drugs, is not free of side effects. So there always are some problems there. But if there is a evidence of hematogenous spread, like it's in the blood, and it does travel all the way to skin, bone, and non-pulmonary site, so we can't leave it alone. We have to weigh out options for antifungal therapy. And again, as we discussed yesterday, IV amphotericin B is the drug of choice. And then again, depending upon what other morbidity exists, we can also try some other drugs if, for example, if the patient happens to be resistant or intolerant to that. And again, the problem that we normally see is this in AIDS patient, because they keep on coming over and over again for a relapse, and also for some of the problems that we normally see. And this is another cycle for coccidioides immitis, and you can see again pretty much the same picture, natural history of mold. And its mold is there, especially in, well, it shows probably Arizona. That's why you see the cactus tree over here and the plant over here. And again, plant-like, you inhale, goes into the system, and then it spreads and divides, and you go through the cycle. The size for this 3 micrometers, so small enough to travel. And again, all those cycles may look familiar, but if you compare all these together in one of the tables that we showed you earlier, you will see that you may find differences in terms of ecosystem, like, for example, I told you pigeon or animals, zoonotic, or any particular water bodies, but these conidia are inhaled, go into the lungs, and pretty much the same story that we see for most of the fungi that are inhaled. And lastly, Histoplasma capsulatum. Again, as I said earlier, I want you to pay attention to this ecosystem. So you can see from the ecosystem, there are trees, there are bird droppings, and then all these things, bats. So these are very specific birds or mammals that become a part of the cycle that we normally see. Again, the pathway is oral inhalation, it goes into the system, and then we have Histoplasma capsulatum, especially as it goes without saying that it has a very important capsule. And when there is a capsule, we do the antigen swelling test, pretty much the same situation. Okay, so that probably ends the lecture part. I'm going to go and now give you comparisons and contrast. And as I said earlier, that's where most of the questions are going to come from. So let me stop here. And Ransford, you want to say something? Yeah.